so this is video 5. We'll continue with this. So we'll see what are the goal. Okay, so we have done with introduction, then we have seen the objective. Next we will go to the goal. So National Health Policy 2002 has laid down the goal for elimination of lymphatic filariasis. So we say that in 2002 itself they had this goal of eliminating lymphatic filariasis by 2015, by which has been revised to, so in the year 2017 they have revised the program again through global goal is 2020. So they are focusing by 2020 that there should be elimination of this filariasis. The strategy includes, so what is the strategy? Annual mass drug administered. So drug should be administered of single dose of diethyl carbamazine citrate, that is DEC, and albendazole for 5 years. So because it is a worm, right, parasite. So albendazole also is given for 5 years or more to the eligible population except pregnant mothers, children below the age of 2 years of age, and seriously ill people. So these people have to be, avoided, and to other people we can give to interrupt transmission of the disease. So we have to give annual mass drug administered of single dose of DEC, that is diethyl carbamazine citrate and albendazole for 5 years or more to the eligible people except of pregnant mothers, children below the age of 2 years, and then seriously ill or debilitated patients. Okay, so this helps in prevention or interruption of the transmission of the disease. And secondly, we see that home-based management of lymphedema cases and upscaling of hydrocele operation is identified community health center, district hospital and medical colleges. So home-based management can be given for lymphedema patients, and then hydrocele in men. Okay, so that can be, it can be operation can be done, a surgery can be done to remove the excess fluid. So it can be done even in the community health centers, district hospital and medical colleges. So these are the main 2 goals. Now coming on to control strategy. So vector control through anti-larval spray or application at weekly intervals with appropriate larvicides. So vector control, we have to make sure it can be anti-larval spray, indoor, which is residual spray, or or aerospacing spray can be used at weekly interval with appropriate larvicide should be used. Then biological control through larvivorous fishes also can be used. As for the malaria we have seen. Environmental engineering through source reduction and water management, proper water management, no leaking of the water. Okay, so that has to be corrected by environmental engineering. Anti-parasitic measures through diagnosis and treatment of microfilaria carriers and cases. So carriers also should be identified, early cases deduction should be done and it should be treated, anti-parasitic measures should be done. Then information, education and communication, that is IEC, to generate community awareness, teaching. Okay, so these are the control strategy where we have seen 5 points. Okay, so this is under National Filarial Control Program, which was launched in 1955. Next we will go to revised strategy for the elimination of lymphatic filariasis in India. So under that, objectives, so reduce and eliminate transmission of lymphatic filariasis by mass drug administration of DEC. Okay, so we have to mass administration DEC of drug should be done to reduce and prevent morbidity in the affected case, disease cases, then to strengthen the existing healthcare services. So they should also strengthen the other healthcare services by providing adequate of medication, okay, so which can be distributed to the affected areas. Then basic principles, when we see the basic principles for the single dose mass DEC administration are interruption of disease transmission. So whenever there is a disease transmission, it should be stopped. Interruption has to be done. Then treatment of problems associated with lymphedema. Okay, disability prevention and control has to be done. So we have to stop the disease, and treatment of problems should be associated with whatever problems are there. Associated problems also should be treated, because when there is lymphedema, it also affects, it leads to pain in the patient. Okay, so at least so disability prevention and control should be done. So salient features of the ELF strategy. Okay, so that is elimination of lymphatic filariasis. So single day mass therapy can be given DEC. Okay, so diethyl carbamazine drugs can be given, citrate drugs at a dose of 6 mg per kg body weight annually can be given. Okay, so single day, every day this dose can be given. Then management of acute and chronic filariasis and self-care methods at doorstep. So they should make sure that doorstep they go, they identify the cases and drugs can be given. Then education, communication, information, education, communication for inculcating individual or community based protective and preventive measures for filarial control has to be done. Then fourthly, anti-vector measures to continue in all of the National Filariasis Control Program towns as complementary to anti-parasitic measures, and microfilaria carriers detected in filaria clinics and elsewhere to receive the standard dose of DEC. So wherever they are identifying cases or prone cases, they can be treated with DEC, diethyl carbamazine citrate 6 mg per kg body weight per day for 12 days can be given. Okay, so this is the program which comes under revised strategy for the elimination of lymphatic filariasis or ELF, elimination of lymphatic filariasis. Okay, and the third program under filarial program is mass drug administration with DEC single dose annually. So WHO has recommended that in a mass treatment should be given as a whole, to group of people, community people, okay, both in the urban and rural can be given together. They should be treated with diethyl carbamazine citrate. So we have seen 6 mg per kg according to the body weight it can be given. It is given to almost everyone in the community irrespective of whether they have microfilariasis or not, whether they are infected, carriers or normal people. For everybody this DEC is given. Okay, disease manifestation or no signs of infection in the area of high endemicity except children under 2 years. It can be given for everybody irrespective whether it is indigenous cases are there or not, except of pregnant women, children less than 2 years and very ill patients. Everyone must be considered to be more or less equally exposed to the infective bites of the vector, and current methods are not sufficiently sensitive to diagnose, because we are not able to diagnose for everybody, but everybody are prone to have vector bite, right? So pre-patent or subclinical infection. So that's the reason it has to be given to everybody equally without any discrimination. No high class, low class, educated, uneducated, urban, rural, nothing like that. But as a mass, the medication has to be given except of 3 prone people. Then advantages of single dose mass therapy. What are the advantages? It avoids the cause of mass blood examination program. So when we give, everybody will develop the resistance to the disease. So no need to do blood tests for everybody, right? So, and no carriers with false negative results. So all members of the community everybody receives treatment. Nobody feels left out, complains. Okay, usually they used to come to the houses and distribute the tablets. So it is effective as 12-day therapy. It is given for 12 days for public health measure. Then it has lesser side effects, thus enhancing public compliance. So no side effects, so people are happy with it. It involves decreased delivery cost. So the cost also is very less. Sometimes it is also delivered for free of cost. It does not require complex management infrastructure. Just go and distribute or keep it in the PHC where people can come and take. So no such infrastructure is required. It can be integrated in the existing primary health center for delivery. So they can give it to the PHC where it can be distributed. Then single dose mass treatment annually in combination with other techniques either eliminated or markedly reduce the transmission of lymphatic filariasis in some countries. Okay, so it is given. So single dose treatment annually when it is distributed. Okay, with other techniques, it is also shown that it reduces the transmission of LF, that is a lymphatic filariasis in some countries. So drug of choice mainly given here is DEC, diethyl carbamazine citrate. 6 mg per body weight for 12 days it has to be given. Okay, so this is about mass drug administration, DEC single dose annually. So today totally we have seen malarial program and various programs under that till the existing 2030 we have seen, and then under National Filarial Control Program again we have seen what is NFCP and then ELF, okay, elimination of lymphatic filariasis in India, then mass drug administration with DEC. So with this 2 conditions we have finished, and later in the next class we will carry on with other control program.